Hello! In this video, I will discuss the purpose of using models to illustrate social science and health constructs. Researchers, evaluators, and planners may find these notes helpful for their work. The purpose today is to discover construct modeling and how it can be useful in research, planning, and evaluation. To explore how using constructs deepen our thinking about the cause and effect of human experience. To show how constructs can professionally explain our findings and convince others of its importance. Construct modeling is most often found in medical and health research and social science research to describe the cause and effect of the human condition. Some of the benefits of using construct modeling is to position your data and your proposed theory or logic model as a new and emerging field, to better define and represent a client group, to examine previously unexplored forces that may impact the client group, to explain the outcome and provide evidence at a macro, meso, and micro level. What are constructs? A construct is a formed idea, empirically built and situated socially, historically, and politically. Constructs may act as an explanation or interpretation of an event or phenomenon. This is different from concept, which is defined as abstract reasoning without any empirical evidence. We need to understand how theory, processes, and outcomes are constructed in theory and how we can deconstruct and restructure them to improve practice. After discovering constructs, we seek to explain how the underlying motivation, processes, and outcome works. Note that what is constructed can be deconstructed to generate additional explanations. Why is modeling constructs important? It is important because it can describe and explain perceived patterns, relationships between parties, and discoveries in data. They can then become building blocks for us to describe variables as they relate to one another. Some of the challenges to using constructs are that our knowledge may be unconsciously based on single stories or dominant narratives about human behavior. Constraints on time, resource, and information, and what the client asks of us may also be a constraint. Contextual information is often simplified and therefore not helpful and cannot be used for modeling or analysis. If client groups are underreported, we may not have enough research available to situate your findings to create a model. What is a theory? A theory is an interrelated set of constructs or variables that present a systematic view of interrelated phenomena by specifying relationships among variables. The purpose is explanation. And here is an excellent diagram showing the direct relationship between an event and experience and theory. As this occurs, constructs become discernible at some point when they're expressed or experienced, which leads to the discovery of an event. Finally, the theory explains the event, how it came about, and what are the impacts and outcomes. Constructs describe the events and sometimes the experience of it by applying a theory that links together the common elements typically considered to be subjectively interpreted. Depending on what point of the research where complex constructs are introduced, it may or may not be provided with evidence. Here are some medical, health, and social science studies which have effectively used constructs in their research. You may now pause this video to read the list and see if any of it interests you. Here are some tools that I've seen that are commonly used for modeling. These are cyclic or acyclic causal models, networking nodes and their functions, and symbolic logic. Last, here are some more symbols that can help you develop your models. These examples are from a study on life course processes and socioeconomic disadvantages for those susceptible to heart attacks. What follows are 3 examples of models that employ constructs at a high level. This research by Stevens et al. Describes obesity in children as being caused by multiple factors found in levels that are micro, meso, and macro. This suggests that to reverse child obesity, the intervention must be multi-pronged by engaging various people, agencies, and settings. This diagram by Kriegel explains how health outcomes need to include what she calls eco-social analysis to explain disease distribution and health inequalities. Health is determined on different levels, location, and times, and even historical events, just as legal rulings by the Supreme Court in the United States. Similarly, in this model, de Guzman and Kolbach note more than one domain is needed to understand humans' healthy behavior. It may include location, social efficacy, neighborhood characteristics, and economic conditions. To conclude, planners, evaluators, and research can model their findings when researching with human subjects. Try putting a list of modeling tools in your toolbox to make it easier for you to apply and experiment with them as you construct and explain human behavior. Use models to understand and communicate the program's nodal structure, cause and effect, and outcomes. Environmental factors can also be used effectively to add information on inputs and outputs of a program. Thank you for viewing. Please like and subscribe.